material, iodine deficiency.
The notes really stress that, don't they? Most common worldwide.
Absolutely. It's fundamental. Just lacking this one trace element in your diet is the leading reason people develop goiters across the planet. It speaks volumes about nutrition's role.
Wow. Okay, so iodine first. We touched on autoimmune disorders with the types Graves and Hashimoto's. Can you elaborate a bit?
Sure. With Graves, the immune system makes antibodies that basically mimic the thyroid-stimulating hormone, TSH. So they push the thyroid to grow and make too much hormone, hence toxic goiter.
So it's being stimulated by the immune system.
Right. With Hashimoto's, it's more of an attack. The immune system targets and damages the thyroid cells. This inflammation can cause swelling, the goiter, often before the gland eventually fails, and you get hypothyroidism. So two different autoimmune mechanisms, both potentially causing goiter.
Fascinating. And what about thyroid nodules? Are they always a cause for concern?
Well, nodules are just lumps in the thyroid. They're very common, and most are benign, meaning not cancerous. But if they grow large, or you have many of them, they contribute to the overall thyroid enlargement, a nodular goiter. A small percentage can be malignant, which is why they're investigated.
Now, this next one is really interesting, goitrogens, substances that interfere with the thyroid.
Yeah, isn't that something? These are things that can actually block the thyroid from using iodine properly or making hormones, so the gland tries to compensate by working harder and getting bigger.
And the examples, some are surprising.
They are. The notes mention foods like cabbage, kale, broccoli, soy, even cassava. But generally, this is only really a factor if you eat huge amounts raw and if you're also low on iodine. Cooking usually helps.
Okay, so it's context dependent.
Very much so. And then there are drugs. Lithium, used for bipolar disorder, and amiodarone, a heart rhythm drug, are specifically mentioned as potential goitrogens. It just shows how sensitive the thyroid is to what we consume.
Definitely.
What else is on the cause list?
Hormonal imbalances are mentioned, like during pregnancy or puberty. The hormonal shifts can sometimes cause a temporary thyroid enlargement, and genetic factors, some families just have a higher tendency towards goiter.
And finally, radiation exposure. Yes. Significant radiation, especially to the head and neck area, particularly in childhood, increases the risk of developing thyroid nodules and thyroid cancer later in life, which can obviously present as